All right, today we're going to be doing a pain assessment, and pain is very subjective. We can't really tell how Amy's pain is unless we get more information from her. So we're going to go in and introduce ourselves. Hi Amy, my name is Charlotte.
Hi.
And I'm going to do a pain assessment.
Mm-hmm.
There are several different methods that we can use to do pain assessment, and there are a couple different mnemonics that I'm going to talk about today. The first one is going to be P, Q, R, S, T, and U, half the alphabet. But P stands for provocative or palliative. And so what I want to do is find out if there's what makes Amy's pain worse or better. And also we're going to consider if there's been any kind of over-the-counter medications or herbal or topical treatments that she's used that has helped or not helped. So Amy, are you having pain right now?
Mm-hmm.
Where's your pain located?
Right here.
Okay, your left shoulder.
Mm-hmm.
All right, have you done anything that makes the pain worse?
I've been bowling a lot.
Okay, so repetitive motions
Mhm.
making it worse. All right, have you tried anything, any kind of medications, over-the-counter Tylenol or Motrin or any kind of ointments?
Some Motrin.
Okay, did Motrin help it?
A little bit.
Okay, all right. So the next question I'm going to ask is the quality. Tell me, what does your pain feel like? How would you describe the pain?
I would describe it as a dull, achy pain.
Okay, is your pain constant or is it intermittent?
Intermittent. Every time I get up to bowl
Okay,
is when it hurts.
all right. So she is also, the R is radiation or region. This is, the PQRST is a little bit out of order in my way of thinking, but the point is just to follow along with the letters. So R is region, is the location. So hers is going to be in the left shoulder. And then radiation. Does the pain radiate anywhere?
It kind of goes down my arm to my fingertips.
Okay. All right. And do you notice the pain going to the other shoulder at all when you move? Okay. All right. The other one is T, which is timing. I'm sorry, severity. I don't know my alphabet. S. Radiation, and then we go to S, severity. Can you tell me on a scale of 0 to 10, 0 is no pain, 10 is the worst pain you've ever felt, what would you rate your intensity of pain?
A 7.
Okay, so it's kind of in the middle. Now we also have to take into consideration that Amy is alert and oriented, comprehending my questions, and we can have an easy discussion. We have to consider for infants or young children or older adults that they might not be able to comprehend or understand a pain scale, and so we have to use other options, and there are different tools that we can use. One of them is a face scale where you just kind of point to the smiley face, and then we also have a flat scale which is for infants, and we have tools that we can use for that. All right. So the other one is, what would you rate your pain before bowling?
Before?
Yes.
A 2.
Okay. And then what would you rate your pain after bowling?
Still 7.
Okay, a 7. And then while you're sitting here at rest without doing anything, what would you rate it?
0.
Okay, no pain at all. So we want to make sure that we're taking into different considerations when we're talking about the severity of our pain. And then timing. T is for timing. So assess the time of your pain. Is there a certain time of day that is worse or better or aggravated?
Just when I bowl.
Okay. And we can also ask if the pain is constant or intermittent, or if there's a combination of both. And then you could also ask if the pain increases at night. With Amy, it just really seems to increase with activity.
Mm-hmm. But sometimes when I sleep on that shoulder, it will cause me pain.
Okay, very good. So at
So
night
I
it can
tend
get
to
worse.
sleep on my right side because my left side hurts when I sleep on it.
Very good. So that brings me to you. Pain is personal. And pain, how is it affecting you? It sounds like it's affecting your sleep pattern, and so you have to make adjustments. Is it affecting your activities of daily living or your work?
No, not really.
Okay.
Maybe when I brush my teeth.
Okay.
Because I have to move my shoulder a lot.
All right, so you could use your other arm. Excellent.
Mm-hmm.
Okay, we also want to see if it's affecting her overall enjoyment of life. Okay. All right. That concludes the P, Q, R, S, T, and U. However, I want to go over another mnemonic that we could use called Socrates. which is Socrates. And this, it starts with S, which is the site, which is Amy's left shoulder. The onset, Amy, when did it start?
A couple years ago.
Okay, so it's a chronic pain that she's been dealing with. C is character, which she described as achy and dull. And then we have radiation. She said it does go down her left arm. A is for association, signs and symptoms associated with pain. That would be, is there any swelling or any redness or tenderness associated that with palpation or redness, swelling, things like that. And then time is T for time course. Is there a pattern as to when the pain is worse? And it is when she's bowling. E is exacerbating or relieving factors. Again, what makes it worse or better? Bowling makes it worse. And then severity is rating your pain on a scale of 0 to 10. All right, that concludes our assessment on pain.